Hello, and welcome to MST and Eastern's Virtual Open Week. Our webinar this evening is on mental health for Christians. My name is Michael Bräutigam, and I'm lecturing in theology and psychology at MST Eastern. I'm also directing our new Center for Theology and Psychology, and one of our team members is giving the presentation tonight, Professor Cordovilla George, or simply KG. Professor KG is a psychiatrist who has served for many years as the Director of Medical Services at the Peter James Center and One Turner Health, and as Clinical Director of Aged Persons Mental Health and ECT for Eastern Health. KG was also the Deputy Chief Psychiatrist for the State of Victoria from 2002 to 2012, and he serves as Honorary Associate Fellow at our Center for Theology and Psychology. This evening, KG will talk about a subject that is particularly relevant for us these days, as we are still in lockdown here in Melbourne due to COVID-19. And that is certainly a challenging situation for all of us, and many people suffer in their mental health. KG presents us this evening with some helpful tools as we aim to think about mental health from a Christian perspective. Now, KG's talk will take around 45 minutes, and we then have the opportunity to engage in about 15 minutes Q&A. So I invite you to come up with some questions, and feel free to post these questions on the bottom of your screen. You see this Q&A box. Please do use the Q&A box and not the chat box. And yes, that's what we're going to do. So I look forward to KG's talk, as I'm sure you do too. I'm delighted that you're joining us this evening, and without further ado, I'm going to hand it over to Professor KG.
Thank you, Michael, and good evening to one and all, and thank you for taking the time to listen to this webinar and to join us at the CTP and the MST Virtual Open Week. Now, Michael is duly qualified as a psychologist and a theologian, and he is, and the CTP, or the Center for Theology and Psychology, is his brainchild. So it's great to have him introduce me. Now, I am neither a theologian or a psychologist, but I am what you'd call very many people call a mad doctor. Usually, as you know, psychiatrists are at the butt of all kinds of jokes. And one of the things is that psychiatrists are mad themselves. So that's often referred to as a mad doctor. Slide, please, the first slide. And also among Christians, I'll show you the next slide. We have also many Christians who have traditionally viewed psychiatry and psychiatrists with suspicion. So not only the general population who consider us as being mad, but among Christians there's always been this view. And I can tell you that when I first started psychiatry, doing psychiatry many years ago in the 1970s in UK, one of the first questions that I used to be asked from Christians was, how can you as a Christian be doing psychiatry? Isn't it an anti-Christian speciality? And I had to sort of explain to them that psychiatry was no less Christian or more Christian than any other speciality. And so that's the view that has been there. Fortunately, that view is gradually dissipating, and now I can tell you there are many more Christians that are doing psychiatry. When I started psychiatry, there were very few Christians who went into the field of psychiatry because they felt it was an atheistic field and tarnished with the image of Freud. And similarly, there was also this labeling of mentally ill. There was a view that either there's no such thing as mental illness, it's either demon possession or due to spiritual weakness. I'll go on to the next slide. And that's not correct. And that's what I would like to have a look today with you, some of the reasons why there is this conflict between Christians and perceived conflict that's been there over the years between Christianity and psychiatry or mental health when it comes to mental health issues. Now, so first of all, I just wanted to have a look at, God created human beings. So when we go into the root cause of illness, God created human beings in his image, we read in Genesis. And it mentions that when he created, he looked at his creation and said it was perfect. But then it all broke down because of sin. And humans are created, I mean, there are different views about this. This is what's called the tripartite view, where God has created man with a spirit, soul, and a body. And we can read that in 1 Thessalonians chapter 5, verse 23. But so God created man perfect. And at the fall, when sin entered the world, the spirit of man died. And we can read that in Genesis, that how Adam and Eve were driven out of the Garden of Eden from the presence of God following sin. And he placed a cherubim with a flaming sword to prevent Adam and Eve to re-enter into the presence of God, into the Garden of Eden. And in the next slide, we can see that we also hear that God, that was the beginning of the separation. It's spiritual. When we talk about spiritual death, it's where there is, as we know, the separation between God and man. The soul of man also became diseased as a result of original sin. And in Genesis, it's a beautiful book, Genesis, the beginnings of all these things that we can see. In Genesis chapter 3, verse 10, it says, following sin, that the man began to hide from God, and God came every day to talk to Adam and Eve. And on the day following the sin, when God came, man hid. And when God asked, where are you? Adam said, we are afraid and we have hidden. Now that is the beginning of fear and being mentioned following creation. And we know, and I can tell you that having dealt with, over the many years that I've dealt with people with mental illness, I find that fear and anxiety underlines most or almost all of the mental illnesses that you meet. And underlying emotion very often is fear and anxiety. And where has that started? From the initial sin that happened. So we were created, God created us to be at ease, to be at peace. But following sin, there was a lack of ease, and our soul became diseased. And that's where the root word of disease comes from, a lack of ease. That's where it comes from. So it became disease. Similarly, the body, the physical part of man, we all know, also became disease as a result of sin. And it's again in Genesis, we hear God's, before that there was no pain or suffering, but following sin, God says to the woman, you will now have pain in delivery. And also to man, he says, you will now, God created man all the time. It was intended that man would work, but work was supposed to be pleasure. But following sin, work became toil. And it says, by the sweat of your brows will you now have to make your living. And so it was not pleasurable anymore. And we also know that the work, the stresses of work are often these days the cause of many emotional problems and worries and anxieties. Even now, following the post-COVID, people are worried what's going to happen with their job, with their occupation, with their financial situation. I'll go on to the next slide. And so the root cause of illness is, as we know, sin. As Christians, we know that. So that means what I'm trying to say is we are all human beings, as a result of sin, susceptible to diseases of the body, soul, and spirit. There is, whether we are Christian or non-Christian, we are all susceptible to diseases of the body, soul, and spirit. And we also know that disease in one area of our life affects other areas, because we are created to function as a whole being. We are not created as compartments, compartment of spirit, one, soul, and the body, but we are created together. And when one part is affected, it affects the other parts as well. I can give you a simple example. Let's say we are suffering from a viral infection. Not many of us have suffered from the current COVID-19, but many of us, almost all of us, probably have suffered from influenza sometime, or flu sometime during our life. And how do we feel when we have a flu infection? We feel body aches and pains, headaches. We feel lethargy, lack of appetite. It affects our interests, our motivation, our energy levels. We feel like just lying down, lying in bed, covering with a blanket and just cutting ourselves from the whole world. So not only are we physically impacted, but our emotions get impacted. And that's when we have a flu, we don't feel like worshiping God or reading the Bible or having a quiet time and being spiritually inclined. So all aspects of our being gets impacted by a simple viral infection. So that shows how one part of our life, so that we are not built as compartments, but how one affects the other. So going on to the next slide, one of the problems that we often have when we get into this state of whether a person is having a spiritual problem or psychological problem is often a question that Christians have. Are we dealing here with a psychological problem or a spiritual problem? And we well know that psychological problems can often present as spiritual problems and vice versa, because we are not built to be, as I said, compartmentalized. We are built as a whole. And many Christians, unfortunately, make the mistake, because very often psychological problems can present as spiritual problems. I can give you again an example. Here's a person who is suffering from depression, a common cause that many of us have heard of, come across, maybe with family, friends, and they're suffering from depression. A person begins to lose interest in everything in life, lose interest in spiritual matters. They begin to have sometimes obsessional thoughts about God, the devil. They begin to have thoughts about sin that of their life, in their life, and all kinds of things that begin to show up as though they're having a spiritual problem. And that this gives a difficulty. Are we dealing here with a primary spiritual problem or sort of psychological problem? But when we make the mistake, because there are spiritual symptoms that come because of a psychological problem, as labeling people as this being a mainly spiritual problem, in a person who is suffering from a psychological problem, it causes more guilt and suffering for the person with a psychological problem rather than helping them. So, but understandably, we know that there are areas of overlap between the psyche and the pneuma. We go on to the next slide. And the Bible very clearly makes a distinction between physical illness, mental illness, and demon possession. There are several references to insanity in the Bible. I've just chosen a few here, a couple from the Old Testament and a few from the New Testament. So for example, firstly, in Deuteronomy, chapter 28, I think we all know this chapter, where God is speaking to the nation of Israel. And he says, now, if you follow me, and if you follow my commandments and obey my commandments, you will be blessed with all these blessings. And then following that, he goes on to say, but if you disobey me, and if you do not follow my commandments, do not follow me, these are the curses that will come on you. And one of the curses in Deuteronomy 28:28, very clearly states insanity as one of the curses of disobeying God or not following God. Then when we come to 1 Samuel chapter 21, David is brought in front of a king called King Achish. And David is worried that if the king knows that he is the king of Israel, he might be imprisoned and even killed. So what does he do? He feigns insanity. He acts as though he's a madman. So it is well known in the Old Testament, the concept of insanity. That's why he acted as though he was mad. And then King Achish says to his soldiers, "Why have you brought this madman to me? Take him away." So that's in 1 Samuel. Then in Hosea and Jeremiah, we read about prophets who behave when they are filled with the Spirit sometimes, or they are feigning it. They behave as though they are manic. You've all heard of manic depressive psychosis. And in mania, how patients behave without any inhibition and begin to act in all kinds of odd manners. So it is mentioned here as maniac prophets in Hosea and Jeremiah. So again, showing there's a concept that's well known in the Old Testament for insanity as being very different from physical illness or demon possession. Then when we come to the New Testament, in Acts and Corinthians, Paul, because of his great enthusiasm and the way he talked about Jesus and about his new faith, some folks felt that he was mad, and he was labeled as, "You've gone out of your mind and you're insane, Paul." So that's mentioned in those verses. And even our Lord Jesus Christ was labeled as being out of his mind or insane by his own family. That's mentioned in Mark. When we go on to the next slide. So there can be confusion between some kinds of religious experiences and mental illness. That does happen. For example, sometimes when patients are suffering from some psychiatric illnesses, in psychotic states, they begin to be much more, their delusional content or their psychotic symptoms could be about God, about Satan, about evil spirits, about seeing God or hearing the voice of God, or seeing angels, or seeing all kinds of visions as part of their illness. And they might then feel about devils coming and attacking them. So then it can be that people might think this is more a spiritual problem here. So there can be those religious themes that can happen in some mental illness. And sometimes both may be present. And in fact, such people often we find gravitate to caring communities. Very often, many of them are often homeless, and they are not, many family have left them, they are isolated. So they come to places like churches where there are caring communities, and we might find people like that in our churches. On the other hand, you find that many secular psychiatrists and psychologists who have in the past, and even today, some of them would say that if you are too spiritual or too religious, that could be a precipitating factor for mental illness. But research has shown and studies have shown that that is not true. That because one is more spiritual or religious, that is not a factor or precipitating factor for any kind of mental illness. Next slide, we go on to, and the next problem that often arises in between Christianity and psychiatry is the difference in terminologies that are sometimes used, the same terms maybe. For a Christian, behavior can often be labeled, it's good or bad. This person is indulging in good behavior or bad behavior. But for a psychiatrist or a psychologist, we don't talk about it that way. We talk about behaviors being acceptable or unacceptable, stable or unstable. And we know very well that social attitudes and standards have changed over the years and are changing rapidly. these days. What we thought was at one time acceptable behavior is, or no, unacceptable behavior now is classified as acceptable in many situations. Now, the role of the psychiatrist or psychologist is not to judge people and saying this is bad or good, but to help a person if because of his illness, mental illness, he has now behaving out of his norm, his behavior has changed, it's become different. Our role is as a professional to bring them back to their norm. Whether saying that is good or bad is not our role as a professional, but to bring them back to what they consider is their normal behavior and which has become abnormal because of their illness. Now, for many Christians, they might think, oh, this is not acceptable. You're a Christian, you should be telling them what is right or wrong. But that is not our role as a professional. Go on to the next slide. Now, another term which causes problems is what the term called guilt. Guilt is another example of a term that often causes conflict due to the different meanings. Now, guilt is a term that's often used by, as we know, by pastors. It's used by lawyers in the legal profession and in the medical profession, especially in psychiatry. But the legal, the medical, and the religious use of the term can be very different. Now, for the legal use, there are laws in the land, and if you break the law, then you are guilty for breaking that law. You have done something wrong. For example, we know even in these days, there have been extra laws that have been put in place for the lockdown in Victoria and the restrictions that are put. And if you do something wrong, you are guilty and you can be fined or taken to prison. That is what guilt is in legally. Now, the spiritual use, very often religious use, is if you do something wrong, according to the commandments or according to the faith of whatever faith it is, you are guilty. You feel guilty because you have gone against what is expected of you as a Christian. So that is the religious use. But in psychiatry, we use the term guilt in a different way. There are three types of guilt, I would say. One is called real guilt. Real guilt is when, yes, we have done something wrong, affects our conscience because we have done something wrong that we should not have done. We have committed a crime, or we have stolen something, or we have committed adultery, whatever. So we feel guilty. That's real guilt. We have to deal with that. But we also use a term called neurotic guilt. Now, what is neurotic guilt? Let me give you an example. Here's a young man who feels called to go to the mission field and feels that he now needs to go to Papua New Guinea as a missionary. But he's a single son. He has aging parents in Melbourne, and he begins to feel guilty, though he feels that God has told him to go to Papua New Guinea, feels guilty about leaving his elderly parents with no one to look after them. And then he finds it very difficult to go and tell his parents about the fact that he has made his decision to go to Papua New Guinea. And eventually he plucks up enough courage and goes to see his parents. And when he tells them, his parents are also Christians, they know that they can't stand against him. So they say, oh, well, son, if God has told you, by all means, go. Who are we to stand in the way? Don't worry about us. Yeah, we are old. We'll somehow manage. Don't worry about it. We'll take care of ourselves. Pouring more guilt on him. That is neurotic guilt. He has not done anything wrong, but that's neurotic guilt. What is psychotic guilt? Psychotic guilt is a term that we use for some of our patients when they're suffering from a psychotic illness. They begin to feel guilty for things that they have no reason to feel guilty at all. I've come across patients who have felt guilty, for example, let's say in these days of the COVID, patients who say, look, it's because I've done something wrong 40 years ago that this pandemic is happening. And when they are admitted to the ward, they will say, please lock me away from, I'm sitting by these patients, I'm going to contaminate all of them. And they will even call you and say, look at my nails. Look, can you see all the germs that are coming out? It's because 30 years ago, I did something wrong. And because of that, God is punishing me. And that is what's happening now in the world. All these things that are going on is because of how bad I am as a result of that. So sometimes they even say, please, can you give me some medication and kill me? That is psychotic guilt, a delusion of guilt for something they did not feel guilty about. So next slide, please. And so then we come to this area of mental illness or demon possession. And we all know this is an area over the years has caused so much of conflict, suffering for many in the church over the years. As we know, in earlier days, many who suffered from mental illness were treated so awfully by the church. People who were drowned, they were beaten to get the evil spirits out of them. Now, there is still, even now, differing views about this whole area. Is this mental illness or demon possession we are dealing with? And as I said, there are widely differing views held about this. But let me tell you, what I'm going to share is my view. It might not be agreed by everyone. Even people who are listening here might feel differently. I'm happy to have a discussion about that. But I'm just going to share my thoughts about this matter. As a Christian, a Bible-believing Christian, I do believe that there is a devil. You meet sometimes these days so-called modern Christians who say, oh, there's no such thing as devil or demons. No, as a Christian, I do believe, as an evangelical Christian, that there is a devil. And who is the devil? According to the Bible, he was Lucifer, the archangel, who was supposed to be extremely smart and bright. And he was so smart and bright, he wanted to take the place of God. And because of that, God banished him out of heaven, and he is the devil. Along with him, there were a number of other angels who were on his side, took his side, and they were also banished. And they are the demons or evil spirits. And that's my reading of the Bible. Now, when we come to demon possession and demon oppression, demon possession is, my understanding of it is when a person, a human being, is possessed by a spirit or multiple spirits, as we read in the Bible, it comes into the person's life and affects them physically, mentally, emotionally, spiritually, in many different ways they can. That is demon possession. Now, again, there'll be a difference of opinion, but I believe that if, as a Christian, a born-again Christian, and I read in the Bible that as a born-again Christian, I am sealed by the Holy Spirit and indwelt by the Holy Spirit, I cannot also be possessed by demons. But there are other Christians who don't agree with that. Now, but I don't believe that you can. I don't believe that the Holy Spirit can live together with the evil spirits. It can't. It won't. And so it can't happen. That's my belief. Now, demon oppression is different. Demon oppression is when we are oppressed by the devil and his evil spirits. The whole idea of the devil is to kill and destroy. And when we become Christians, there will be more oppression and more persecution, more attacks of the evil one. He's out there to kill and destroy us. So that is demon oppression. Now, the manifestation of possession and oppression in a person can result in physical symptoms and signs, psychological symptoms and signs, or spiritual symptoms and signs. Now, but what we find is that, unfortunately, over the years, there has been a belief among Christians that if a person is demon possessed or demon oppressed, then the symptoms and signs are exhibited through mental illness And that is often the result of demon possession. But if you read the Bible, that is not the case. And I'm just giving you, there are many, many examples of demon possession, as you know, in the Gospels. And I'm just giving you some examples from just Matthew. And if you just read these verses, you'll find that, yes, one of them gives you an example. That's the man when Jesus and his disciples crossed the great Lake of Galilee and came to Gennesaret area. There was a man who was filled with evil spirits, and he behaved as a madman. He had clothes that were torn. He was living in the cemetery, and he was violent, aggressive. He behaved like a madman, and Jesus cast out the demon. But all the other examples that are listed there, where people who were having demon possession, but the way they demonstrated that demon possession was through physical symptoms and signs, either blindness, deafness, muteness, epilepsy. And when Jesus cast out the demons, they began to see, they began to hear, they began to speak properly, or the convulsions disappeared. So I often ask people, why is it that you only consider that psychiatrists deal sometimes with people with demon possession? Why not neurologists who are dealing with people with convulsive disorders? What about those with eyesight problems who are going to ophthalmologists? What about those of hearing problems going to ENT specialists? We should be aware that demon possession can exhibit themselves, if the patient is demon possessed, in different spheres. And the bulk of the patients or people that have been described in the Bible exhibited more physical symptoms and signs rather than mental illness. But somehow we have got into our minds that demon possession, the exhibition of demon possession, is usually in mental health problems. That is not correct teaching as far as I'm concerned. Going to the next slide. My feeling here is, when it comes to this, whether it's demon possession, mental illness, one needs a gift of discernment. And not everyone has that gift. And in Acts chapter 19, it well gives an example of some sons of a priest who decided to cast out a demon, and the demons then turned on these folks and said, Jesus, I know, Saul, I know, who are you? And attacked them. And they all had to leave with, naked, without any clothes, because the demons had attacked them. Now, my feeling is that if you talk to many missionaries who have worked in the East and in developing countries, they all say, well, we have come across people who were demon possessed. But in the West, most of my practice has been in the West, and I can say there have been probably one or two cases where I've thought, is this demon possession? But the bulk of them have been mental illness that I've dealt with. And why is that? Because in the East, many people have been involved in demon worship, devil worship, idolatry, giving the devil an access into people's lives. But fortunately, in the West, we have had Christian influence over the centuries, and because of that, probably there has been less of that demon possession that we can see here. But unfortunately, as people have moved away from Christianity, people are now openly worshiping the devil, openly going into all other kinds of religions. We will probably see more cases of demon possession than what we have been seeing. My advice would be, if you have any doubt whatsoever, we don't have a gift of discernment, refer to people who might have that gift. And if you still can't find anyone, or if you still have doubt, treat them, especially in Australia, you treat them first as a patient with mental illness, refer them to a mental health specialist. And I would say, it will do less damage rather than labeling someone who is mentally ill as being demon possessed. They're already feeling terrible with their mental illness, and we say this is demon possession that you are suffering from. You'll make them even more guilty and worse in their mental illness. So as Christians, we need a very balanced view in this area. Next slide. We'll go on to the next slide. Now we come to another area of sort of difficulty among Christians, and that is what's called Docetism. Docetism refers to a heresy in the early church that held that spirit was good, but matter, including flesh, was evil. Now, in an effort to protect Christ's spirituality and divinity, the Docetic heresy said that Christ only seemed or appeared to have a human body. He didn't really have a human body. And so the heresy said that Christ did not really suffer physical pain. Now, the early church rejected Docetism and acknowledged that Christ could feel pain, that he was 100% human. And so the Docetism was thrown away as a heresy very early after the heresy came into existence. But the unfortunate thing is that over the years, many Christians have unknowingly developed a spirituality that denies the humanity of Christ's followers. Next slide. And we, as a result of that denial of unpleasant human feelings, such as anger and grief, in the name of Christian joy, and that damages emotional and with damaging emotional and physical consequences. You know, the number of Christians that I've come across who said, who have been hurt by others, who feel upset and angry and say, no, I'm not angry. I'm a Christian. I don't feel anger. That is being false. We are emotional beings made with emotions of anger, with fear, with grief, with sadness. We have to acknowledge it. The Bible never says that anger is sin. Bible says, be angry, but sin not. And I wish sometimes that many more of our Christians would become angry with all the things that are happening in the world these days, you know, and taking action about that with anger. It is not anger that is sin, but the way that we express the anger. If we use it positively for positive good, then there is no sin at all. If we use it destructively against a person who has made us angry, or use it in a bad way, then obviously that is sin. That's why it says, be angry, but sin not. And do not let the sun go down on your anger. Recognize it and use it for the good of humanity and for the good of the kingdom of God. The same with grief. Number of people who have lost someone that they love, and they say, oh, I'm not feeling sad. I rejoice in the fact that my loved one is now in heaven with the Lord. Do you not feel grief? You have known someone for years, you have loved. They are now lost to you, and you don't. How can we say we don't feel grief? It's a natural reaction to feel grief. But then we say, oh, we are supposed to be happy as Christians. No, it doesn't say that we are every day of our week, 24 hours of the day, 7 days a week, we need to be happy. It talks about Christian joy, but that is not being happy. We do have these emotions, and the sooner we recognize this, the emotions that we have, the better we are people, and we are able to help other people too through their emotions that they are going through. And also we have people who, because of that denial of human development, influence of the past, we know that impacts on our present. Many Christians, they forget about what has happened in their upbringing, and they suppress it, not recognizing it, and because of that, they cannot develop and mature in their personality. Denial of human value with consequent poor self-esteem. So these are all impacts of the Docetic heresy, even though we have thrown that away, the heresy, but these are lingering effects which we put on our other Christian brethren. Next slide, please. Now, so we're coming to the close. Mental illness is real. Now, in Australia, it is well known that 1 out of every 4 person that in Australia will suffer from some kind of mental illness sometime during their life. 1 out of 4, 25%. And let me tell you, after this pandemic and all these things that have happened, there are going to be probably even many more cases of mental illness that we are having to deal with in Australia. Now, whether we are black, white, yellow, brown, mental illness doesn't select anyone. It impacts everyone. And it doesn't matter what age we are. We know, for example, that 10% of children and youth suffer from mental illness. That's why so much of money is being poured into youth mental health. And the elderly, my specialty is elderly. 20% of older people over the age of 65 suffer from mental illness. It is a huge problem among the elderly. And depression is the commonest mental illness in old age. Now, in the Bible, there are examples of Bible characters with mental illness. The prophet Elijah's mental meltdown in First Kings chapter 19. You know, after his showdown with the prophets of Baal, when he won that battle, immediately after that, the high, he went into a low, and he ran and hid, and he wanted to die. He told God, I want to die. There's no point in living. And when you read that, that passage is beautiful, how God, as a perfect psychologist, dealt with him. It's an example, a good example of a psychological remedy. First thing God did for Elijah was to let him sleep. And then angels woke him up and fed him, took care of his physical needs, because for days he had traveled without any food or sleep. Then he let him sleep again, and then the angels woke him up again and fed him. Then after 40 days, God very softly, in a soft voice, not in any way attacking him and saying, what kind of a person are you? What happened to your faith? Very softly asked him questions. What are you doing, Elijah? Why are you here? What's happening? And that was a psychological therapy. Very often, like what we, the therapy, when you look at that, very similar to cognitive behavior therapy that many of us have heard of. Now, King David's emotional suffering after his sin is well described in Psalm 38. If you read that chapter, again, beautiful description, I think, of someone who is suffering from depressive illness. All the symptoms and signs of depression are there in Psalm 38, if you read that. And then if you read in Daniel chapter 4 about King Nebuchadnezzar's insanity, after he became very proud, but having a delusion of grandeur, he became mad and was in the field as a madman, nails growing and his hair growing, and he eating the grass of the field, like a description of a chronic schizophrenic. We don't see many of them these days in the street, but if you go to places like India, you can still see people wandering the streets like that. A good description. For 7 years, King Nebuchadnezzar was insane. And next slide. Then we come to more modern day examples. Believers struggle too in our current, in the past and in the present. Many Christians suffer from mental illness. We all have come across, I'm sure. William Cowper is a good example. He was a famous hymn writer who has written many hymns. One of them being, There's a Fountain Filled with Blood. I think many of us will know that song. He suffered episodes of depression, even to the point very many times he became suicidal. Charles Spurgeon, the famous writer, preacher, struggled with depression. And we all know of fellow believers who struggle with mental illness. Next slide. And some Christians, in conclusion, let me say, some Christians have caused a sense of guilt among fellow believers from psychiatric illness and emotional problems. We've also tended to look down on Christians with psychiatric illness and emotional problems as weaker in the faith. And most of the confusion has happened because in Christians is because of our ignorance, wrong teaching, and wrong interpretation of the Bible. Next slide, please. There's a great scope, as far as I'm concerned, for Christians to be involved in the sphere of mental health. Great scope. And we know that the biggest single factor, research that has been done again and again, have shown in any form of psychological therapy, the biggest single factor for success is the therapist. Not the kind of therapy that is used, but the therapist himself. And if we as Christians, we believe that we are indwelt by the Holy Spirit, when we are dealing with another human being, the Holy Spirit is working. What a great gift we have to deal with people with emotional problems and mental illness. Christian Initiative pioneered reforms in the 19th century as regards the care of the mentally ill. When many of them were treated so badly, it was Christian Initiative that pioneered that. And now we are in a post-Christian world. Yes, we are. And we have many more challenges in the post-Christian world. But I believe as Christians, not only that we have challenges, yes, but at the same time, great opportunities. More opportunities now as Christians to shine forth as Christians in the area of mental health. Next slide, please. So what can we do as Christians? Reassure patients and families that we come across in our churches, in our house groups, in daily life, that there is help available. Assure them that we are willing to help in whatever way we can. Talk to the family and obtain as much history that you can get. Refer to a professional. Keep in contact. That's something that all of us can do. Offer support, prayer, emotional support, and other practical support. And more important, that educate our church members about mental health. Thank you very much for taking your time and listening. And if there are questions, feel free.
Thank you so much, KG, for this fascinating presentation. And we do have quite a few questions. We have at the moment 24 questions. We'll see how many we can answer in the remaining 10 minutes or so. But if you want to stick around, KG has agreed to stay another 15 minutes with us so we can look at most questions as we can here. Now, KG, some of the questions that came in are around the question of how do you as a Christian serve in a secular context? How do you bridge the gap here between the psychology or psychiatry and your spirituality and the theology?
I have had no problems with that at all. And as I said, this was a question that's been asked of me from the time I started doing psychiatry. And I would say, actually my first love when I was a medical student was to do obstetrics. I thought that was a fascinating subject, to see a new birth, a new child being brought into the world. But a few incidents happened during my internship days, which turned me completely around. I nearly gave up medicine, went to full-time ministry. But through an Australian missionary doctor, I was led to continue with my medical profession. And that's when I decided to take up psychiatry. And I used to tell folks when I was asked, how do you as a Christian do psychiatry, this non-Christian field? I would say, look, I'm so glad that I went into psychiatry. In this day and age, I would have had probably more ethical problems, theological questions, if I was a Christian obstetrician or gynecologist, things like, all the ethical issues that are coming up, including abortion and all the other things that are there that's happening. Psychiatry is no less or no more Christian. One of the beauty of psychiatry and psychology is you can come with your Christian worldview. People come with different worldviews, and you can use your Christian worldview and look at a human being from birth to whatever stage you're looking at, and bring that view into what you are treating and treat them. with that worldview that you have, a Christian worldview. And in no way in psychiatry does it negate the way that you're dealing. Obviously, like any field, we have to, when we're talking about sharing our faith, for example, we have to do with permission, sensitivity, that we have to do that. That's a different matter altogether.
Thank you so much, KG. That's very insightful and helpful. Now, another few questions are around the issue of how do we deal with friends in church who are suffering from mental health problems? How does the church deal with that? Should we refer them to experts, or what is the role of the pastor here, or fellow congregational members? How would you answer that?
Yes, look, we are always going to come across, as I said, just because we are Christians, we are not going to be immune from suffering from mental illness. And as I also mentioned, 1 out of 4, Australian, in Australia, we will be meeting people, I'm sure. So how do we deal with them? Certainly, as I mentioned at the last slide, we didn't have much time to look into that, would be, first of all, to show them that we care. Talk to them to find out what the problem is. If it is something that you can deal with at your level, or with the support of the house group or cell group or, pastor, certainly do that. Some of the issues that come up might be something that we can deal with that. Many of the churches that I know now have got counseling departments. We can refer them to the counseling department in the churches that we have, or Christian organizations that we have. There are many Christian psychologists that are available now, that if you want to refer them, someone who is probably more Christian, if you feel. And also, if you are unable to make out, as I said, whether there is something more deeper going on in the way of an illness that needs more professional help, then certainly we feel that some of the things that the person is saying, the things that they are talking about, sounds as though it's more than just, a feeling anxiety or feeling depressed. It's becoming more than that. Then by all means, I think we should be advising that they be referred on to a specialist via the general practitioner that they have, all our patients have.
Thanks, KG. Another question is about medication. So we read a lot about the usefulness, obviously, but also the abuse of medication. So what is here the relationship between counseling and medication? When do we need, or is there maybe an over-reliance on medication here? One guest is asking.
Is there an over-reliance on medication? Certainly, I think I agree with that. There is these days, everyone going to a doctor immediately wants a pill, whatever the reason, not only just mental illness, but also for physical illness. Many of the physical illnesses, probably we shouldn't be prescribing them medications as we are doing now. There is over-prescribing, no doubt about it. Now, so when it comes to mental illness, we talk about there is no single, what we call etiological factor or causative factor when it comes to mental illness. We talk about what's called biopsychosocial. So there are often for an illness that someone is suffering mentally, there are biological factors, there are psychological factors, there are social factors. So this is where we have to tease out. If the person begins to have very often a person with a mental illness, like a severe depression, when a person is let's take the example of the person who is depressed. There are what we call patients with severe depression, what in our medical language we call melancholic depression, a depression where they begin to have physical symptoms and signs. Then they need medication as well. Just counseling by itself is not going to help. If a person becomes psychotic, they begin to have psychotic symptoms like believing things that are not there, seeing things that are not there, hearing things that are not there. They have become psychotic. They need medication and they need physical treatment. Very often when it comes to psychiatry, it's a combination of medicine, psychological treatment, social treatment, all these treatments together. And that's why biopsychosocial factors cause the illness. And when it comes to treatment, we have to also direct the treatment in all these areas together.
Thank you, KG. And maybe we got time for one more question here in our time frame. Now, what do you think needs to happen in the church? This is what two people are asking here, to make people with mental health problems feel more welcome at the church. In which ways does the church have to change?
The question would be, are we talking about what kind of mental illness? There would be many, I'm sure, of our congregation who are suffering from mild forms of mental illness that many of us probably are not even aware that they have higher levels of anxiety or mild forms of depression. And I'm sure there'll be many sitting in our churches with those kind of symptoms. And I hope that we do make them welcome and we try to help them as much as we can. And as I said, many of them probably won't even exhibit those symptoms for you to know that they're suffering from a mental illness. But if we are talking about those who are suffering from more severe mental illness, for example, schizophrenia, and that's probably where the question is coming from, because many of them then begin to behave in ways that are not in keeping with societal norms. They might come in smelling when they come in because they have not had a bath properly, or they might look disheveled and might not fit our social norms, or they might come and sit down and become disinhibited in their behavior because of their mental illness. They might start shouting when they shouldn't be, or start speaking when they shouldn't be. I feel that as a church, as I said, many of these folks might be attracted because it's supposed to be a caring community. They find care and support there. That's what we should be. And we should be looking at what would Jesus do in that situation. Would he be saying, oh, you're being a social nuisance here, you're disturbing others, or do we try and incorporate and give them the attention and time that they need? And sometimes it might be that we begin to, in our churches, look at people who have psychological training, who have psychiatric training, who have medical treatment training. And probably when people like that come, we might get them to be seeing these people that we know have that expertise, talk to them a bit more and see whether we can help them in more professional manner as well.
Thanks, KG. And we have so many questions, so I think we go over time. And thanks, KG, for your readiness to stay on. If you have to leave now, thanks for watching and thanks for joining us for this webinar. There are more webinars scheduled tomorrow for Virtual Open Week here at MST Eastern. But we would now continue for another 15 minutes here with Professor KG, who is answering questions on Christianity and mental health. Now, here's a question, KG, that is asking for the different schools of psychological thought and treatments. And are there some that are more compatible with Christianity and others, or we're thinking about elements maybe of some therapies and practices where we as Christians might say, oh, I'm not sure about this if I want to go ahead with that?
Good question. Now, there's certainly, as I said, many psychologists or therapists would come with their own worldview, and they might specialize or become experts in that way of dealing with a person. So there might be things that we feel uncomfortable with. For example, I think there has been debate. For example, let me take up this issue about mindfulness. For example, there is a debate in the church whether mindfulness it can be a therapy that's used by Christians, because the roots are from Eastern religion, from Buddhism, as we know. That's where mindfulness has come from. So would that be compatible with Christianity as a model of therapy? Now, let me say that on October, can you remind me the date, Michael? October.
That's on the 15th of October.
Yeah. So I think this is a plug for that. If people are interested, want to know more about that, there is going to be a talk on Christian mindfulness, or a Christian viewpoint about mindfulness. Now, many of us will have probably different views about that. And some will say, oh, because the roots are there, if a root is bad, then the fruit can't be good. We will have different views. So yes, there might be questions about that. Then, for example, some will say, well, what if it is that meditation, what about yoga as a meditation? People use, there are therapists that use yoga, not only exercise, but the meditation. Is that right for us? I think that's something that each one of us probably individually will have to seek out his or her view and probably talk to someone. I don't want to today publicly make statements about that. Probably talk to someone that you have confidence with, see what they feel, and come up to your own view about these various therapies and treatments, and decide whether it is right for you as an individual to be involved in that treatment.
Thanks, KG. And here we have one participant who is asking, as a Christian patient, is it essential to seek help from a Christian therapist or professional, probably in comparison to a secular one?
Look, let me say, from the point of view of a psychiatrist, it might be different when we talk about some of the therapies that are being used. But as a psychiatrist, let me say, over the years that I've worked, I've worked many years as a psychiatrist. I've not come across that. There might have been one or two who have been sort of anti-Christian, but even those who have been probably anti-Christian, I have found them to be professional enough so that when it came to the point of view of treating a person, they would be professional enough to be able to understand, appreciate, and accept where the patient's faith or where they are coming from, and not wanting to put or instill their views on to the other person. And similarly, I mean, as a Christian, I would have to be careful as a professional not to put in a time when a patient is vulnerable due to their illness, that is hardly the time for me to put my views and my thoughts into the person's mind. As I mentioned earlier, the view as professionals, our role is a person due to their mental illness, their way of thinking, their behaviors have changed, have now become abnormal. And the view of a psychiatrist is, for what we want to do is to try and get to a diagnosis as to what has caused this problem and treat them so that they come back to their normal, what they consider as normal, what is they feel is acceptable for them. And that's our role. And it is not to impose on our faith, our values, our systems on to the patients that come to see us. So I don't think that seeing a non-Christian psychiatrist would make much difference, but certainly if you have a Christian psychiatrist, certainly you'll be able to more freely talk about your faith issues with them as well. That will be the positive part of seeing a Christian psychiatrist.
Thanks, KG. And we have had quite a few questions here asking for referral options to Christian psychologists, counselors, psychiatrists. Please send us an email on our CTP email address, and you find it online, and we can send you some answers here. Now, two questions here came in regarding the difference or regarding the nature of the soul. What is the soul? Do you distinguish the soul from the spirit? Talked about the tripartite view. Maybe you can say a little bit about that.
Yeah, again, as I said, there are different views. So that certainly in theology, there is the tripartite. I mean, I think Michael will probably be able to tell you more as a theologian. And those who say there's only the, spirit and soul are the same, but there is the view that spirit and soul is different. And if you had looked at my slide, you might not have had the time. I would be saying, I believe in the tripartite being, and the soul, I would say, consists of the intellect, the emotion, and the will. the way we think, our feelings, the emotion, and the will, our decisions that we make. So intellect, emotion, and will consists of the soul, while the spirit is the higher senses, our consciousness, our ability to have the relationship with a higher being. All those consist of the spirit, while the soul is the intellect, emotion, and will.
Thanks, KG. And maybe I can throw in a question here, because I'm really interested to hear from you, what do you think will be the long-term effects of this lockdown? Because we've living here under quite harsh restrictions, and what can you tell us as a psychiatrist? Are there maybe any long-term effects, and what can we do about it?
Yeah, I mean, whether there'll be long-term effects is difficult to say at this stage. I mean, we just have to wait and see what happens. But certainly in the short term, I am quite sure that there will be many more people suffering from anxiety because of what's happened. There'll be many more patients, or people, I wouldn't say patients, people suffering from panic attacks. They're already suffering from anxiety and panic. Patients suffering from grief in many ways already because they can't see their children, grandchildren, and people who have died of their family, they're not even able to mourn with the way that they should be because of all the restrictions that have been put on them. Many people who should be getting appropriate therapy at this stage for their whether physical problems or psychological problems, they're not getting it as they should because of the fear of going out, because of the fear of getting COVID, because of the fear of the inability to get in, to travel, to go where they have to, giving the problems of inadequate treatment, making some of their psychological problems even worse than what they are, some of their physical problems worse than what they are. So all this will have certainly not only a physical but psychological impact. I'm sure that there would be an impact, at least in the short term. How much of this is going to be long term, I think we'll have to probably wait and see. Thanks,
KG. And here's one question on the topic of demon possession you talked about. And this person wants to know, if it is demon possession, how do I, as a mental health practitioner, handle it? Maybe you could talk about your own experience, perhaps.
Yeah, no, I said I probably have come across over the 40 over years of working in psychiatry. Most or all of my practice in psychiatry has been in the West, and so as I said, I probably, if I was working in India, I would have probably picked up more cases. But because it has all been in the West, there probably be just one or two patients that I've seen who have wondered whether some of the symptoms that I'm seeing is due to something more than a psychiatric illness that I'm dealing with here. But I would not say that I have the spirit of discernment here. As I said, the gift, not spirit, the gift of discernment. I have even the patients that I have where I had wondered whether this was the case. I've treated them as psychiatric patients. Most of them may be improved, but maybe not achieve the kind of improvement that I have hoped for. And that's probably where I have often wondered whether that was something more going on. How would you deal with that? It's a difficult area. How are we going to refer someone like that if they are not open to it for some kind of spiritual help? If they are open, if you feel that there's something going on like that, if they are open to it, then obviously the thing is to refer them on to those who have that expertise in that area is what I will be suggesting that we do.
Thanks, KG. And here's a question about personality disorders. So this participant wants to know, is it right to believe that personality disorders cannot be cured? And so how can their families live with it?
Personality disorders, these days, I think there would be those who are specializing in this area would say that is not correct to say that personality disorders cannot be helped, or maybe not cured, but at least there is treatment for a lot of the personality disorders, even the very severe ones that we come across. There are treatments that are available. Whether they'd be cured completely, that's a different question. So now what we need to remember is that we all have different personalities because of the way that we have been brought up and our upbringing. And we have personality traits that are there. Some of them are very difficult for us who have got those personality traits to change, maybe. So what do? We have to probably, realizing that that's the case, we learn to live with that and behave accordingly. And the people that we live with probably also have to begin to learn that this is the case and learn to live with it. So I wouldn't give up complete hope. There are many psychologists who specialize in this area of personality disorders. And even in Victoria, we have a specialist unit called Spectrum that deals with people with personality disorders. So if there are people that you know, they can be referred to these units that work with people with severe personality disorders.
Thanks, KG. And there were a few questions here about the role of prayer and also the role of the Holy Spirit in counseling and psychological psychiatric care. What would you say to that?
Of course, prayer always helps, whether it be physical illness, spiritual, psychological problems. As Christians, that's what we believe in, that the prayer and the work of the Holy Spirit. Now, the question is, do we pray with our patients? If there's a Christian who is open to it, certainly. If somebody in the church that we can work with them from a spiritual point of view, prayer, certainly do that. But the question is, if it's someone that you are professionally dealing with who is not willing for it, and how do we do that as professionals? And this is where we have to do it with great sensitivity. We are not there primarily to be, to try and deal with their spiritual matter. We are there as professionals to deal with what they have come for, whether it's a physical problem or psychological problem. But maybe there might be an opening from the way that we deal with them. People begin to see that there's something different here. Now, here, can I just suggest, there is a course that is happening that's been going on for many years, and that's called the Saline process, which many those in the health fields as Christians, I would encourage greatly if you can be involved in the Saline process training, which shows how we can be witnesses, not evangelists, but witnesses in our workplace, sensitively, how we can do that in a way that will bring our faith through and help many of these patients. Now, so yes, prayer, definitely, as a Christian, I would say prayer helps. And prayer doesn't mean that we have to pray with the patient. We can always pray for a patient. Every patient that we meet, we can be praying. We can be praying silently before we meet them. While we are working with them, we can be praying for them. Nothing is going to stop us. And certainly prayer will help. I've got no doubt about that.
Thank you. And probably the last question, and we have to finish, unfortunately. Are there any resources you can recommend, KG, maybe books or any talks or anything you have in mind that could help us learn more about that subject?
Yeah, so why don't, again, like what you said earlier, Michael, when they were asking about referrals to Christian psychiatrists and psychologists, if people want to write into CTP, then we can make that available, resources that can be made. That's what our center is for, as a Center for Theology and Psychology, to help people, the church in Australia, to be more aware and to help people in this whole area of theology and psychology. So I would encourage people to be in touch with our center, write, be in contact, and we are there to help you.
Wonderful. Thank you so much, KG, for your time and your preparation and all the effort and for answering all these questions. And thank you for participating and thank you for asking these questions. Thank you for your interest and for joining us this evening. This has been truly fascinating. So I hope you enjoyed it as much as I did. As KG said, please stay in touch. If you have any serious questions, you really need answers, please send us an email. And again, I invite you to join us for the other free webinar with CTP on Christian mindfulness with Dr. Catherine Thompson on the 15th of October. And you can register on our website. MST and Eastern's Virtual Open Week continues tomorrow morning. And if you're interested, you're most welcome to join us tomorrow at 10 a.m. for an introduction into what we're actually doing at MST and Eastern and what offers we have available for you. Again, thanks for joining us, and I wish you a very good evening, and God bless you. Goodbye.